guys, you're welcome to DSSG Nation. So if this is your first time watching the video from DSSG Nation, do make sure you subscribe and you hit the bell button so we can notify you whenever we create any video. So today we are going to be talking about renal failure. So pick your paper and your pen and let's get started. Hi guys. Yeah, welcome back. So I said we are going to be talking about renal failure. Renal failure. Now, the word renal means the organ kidney. And the word failure means inability to perform a function. So, if you say renal failure, it means inability of the kidney to perform its function. So that is the meaning of renal failure. Now, when we say renal failure, we said the organ affected is the kidney. So let's take a quick look at the anatomy of the kidney, but not really the cross section. So that's the blood supply and then the outflow of urine and blood from the kidney. So what do I mean by that? The kidney is just a bean-shaped organ. It's a bean-shaped organ, and it receives blood supply from what? From the abdominal artery. Abdominal artery. So the abdominal artery is going to branch into this artery here called renal artery. Renal artery. And from there, the blood is going to enter into the kidney proper. And the kidney is going to form urine from that blood entering into the kidney from the renal artery. And when it forms the urine is going to pass out through a tube, a tube-like structure rather, called the ureter. Ureter. Now, from this, we realize that the kidney is getting its sustenance from what? From the renal artery. And then it uses its blood that it's receiving. It uses the what? The blood that it receives from what? From this artery to process what? To produce urine. So, if you don't know anything about the kidney, just go and watch our video on description of the kidney. You'll understand the formation of urine from the blood. So after that, let's come with the types of renal failure. So, stay tuned. Yeah, welcome back. So, we said we are going to be talking about the types of renal failure. So, majorly we have two types of renal failure. So, the first one is called acute renal failure, and the second one is called the chronic renal failure. So, what is the meaning of that? We used to define acute renal failure and chronic renal failure based on two criteria. So the first one is based on the onset of the disease. Based on the what? Based on the onset. Based on the onset of the disease. And the second one is based on the reversibility of the disease. Reversibility of the disease. So what is the meaning of that? For acute renal failure, it has a sudden onset. A sudden what? A sudden onset. It occurs suddenly. But for chronic renal failure, it has a gradual onset. So, that is, it starts gradually. And for the reversibility, the acute renal failure is what? Is reversible. Reversible. But for chronic renal failure, it is irreversible. Irreversible. Now, from these two criteria, we can define our renal failure, either acute or chronic, using them. So, if you want to define acute renal failure now, you are going to say, you are going to define your renal failure first. So, like the inability of the what? Inability of the kidney to perform its function. and it occurs suddenly and it is reversible. So, same thing for the chronic renal failure. Inability of the kidney to perform its function, and it occurs gradually, and it is irreversible. Or you can still twist it around by saying this is a sudden and reversible damage to the kidney. So here as well, you can call it, this is a gradual and irreversible damage to the what? To the kidney. So that's how to define what your acute renal failure and your chronic renal failure. So let's go to the causes of what? Of renal failure itself. So stay tuned. Yeah, welcome back. So, talking about the causes of renal failure. Causes of renal failure. So, talking about the causes of renal failure, the causes of renal failure can either be pre-renal, or intra-renal, or post-renal. Post-renal. Now, this is just the classification of the causes. So they classify the causes of renal failure based on whether it is pre-renal, intra-renal, or post-renal. So what's the meaning of all these terms? Let's start from pre-renal. But let us quickly give a brief intro again about the blood flow to the kidney and the formation of what? Of urine. So just like I've said earlier on, the abdominal aorta runs within the abdomen and then it bifurcates into what? Bifurcate means to divide. So it is the anatomical word we use most of the times for division. So it bifurcates into right and left renal artery. So these are the what? The renal arteries. Renal arteries. So let me just focus on this side. So it supplies the what? The kidney. It supplies the kidney with blood. And when the blood enters into the what? Into the kidney, it is going to be sheathed or filtered by the nephron. And with a lot of processes, it is going to form urine at last. It is going to form what? Urine. And the urine is going to pass out through a tube called what? Ureter. Now, it means this blood right here is the one that forms what? That forms urine into the ureter. Now, using this blood flow, we can divide the function of the kidney into three. So, the first one is, I don't mean the function, I mean the blood flow right here, we can divide it into three. So, one, on its way into the what? Into the kidney. So, the other one is the blood within the kidney. And the last one is the blood outside the kidney. Outside the what? The kidney. So using all these, we are going to understand our pre-renal, intra-renal, and post-renal. So for pre-renal causes, the word pre means before. And the word intra means within. And the word post means after. Now, using that, if you say pre-renal cause, it means the causes of renal failure that result from what? From obstruction of blood flow to the kidney. So it means before the kidney. The causes of renal failure that occurs before the what? Before the kidney. So that is anything that affects the blood supply to the kidney. So anything that brings about reduction in blood supply to the kidney, they are categorized as what? As pre-renal causes. So for the intra-renal cause, that is within the kidney. So any kind of disorder affecting the nephron of the kidney that prevents it from what? From performing its function, that causes its failure, is what we call the intra-renal cause. So those causes are what? They originate within the kidney. So the last one is the post-renal. It means after the kidney. So after the kidney, anything that affects any structure below the what? Below the kidney and prevent the flow of urine. So those things are regarded as what? As the post-renal causes. Now let's start talking about what they are. So before I clean the board, let's just talk about this pre-renal. This pre-renal they bring about reduction in the amount of blood supply to the kidney, which means they affect the renal artery most of the times. So those things that can cause reduction in blood supply to the kidney include shock. So and after that we have embolism. If there is a kind of embolism here, such as thromboembolism. So apart from that, other things under pre-renal causes can be what? It can be fat embolism, and if someone is suffering from heart failure, so blood is not going to get to the kidney very well. So heart failure can also lead to what? Can also lead to renal failure. So after that, we have different causes like that can lead to what? That can lead to renal failure that are pre-renal. So anything that reduces the blood flow to the what? To the kidney, they are categorized as what? They are categorized as pre-renal cause. So let's clean the word and then we'll talk about the intra-renal cause. So stay tuned. Yeah, welcome back. So talking about the intra-renal causes. So they are what? The causes of renal failure that originate within the kidney. So there are diseases affecting the what? Affecting the kidney. So example is glomerulonephritis. We've done that, so you can just check our previous video. Glomerulonephritis can lead to renal failure. Nephrotic syndrome, we've done that as well. Nephrotic syndrome. So infection on a large scale. So infection of the kidney. So after that, we have Fabry disease. So other things such as acute tubular necrosis. So for this acute tubular necrosis, it is just like what is really affected the renal failure. So if you say tubula, it's referring to the renal tubule. So the renal tubule of the nephron. So if you say necrosis, it originates from the word necros, which means death. So death of the what? Of the cells of the renal tubule of the nephron. So acute, which occurs suddenly. So although after acute, they also call it kidney. Not kidney. After acute, you have another word for it, and it's not sudden as well. But I'm going to remember that before the end of the video and then talk about it. So that is that about the intrarenal causes. So talking about the extrarenal causes. Extrarenal causes or postrenal causes rather, the postrenal causes. So the postrenal causes, they are those things that can lead to renal failure that start from what? That obstruct the urine flow. So the diagram I showed you the other time, I said the urethra is right here. So and then urine is formed like this. So anything that can obstruct it. So example of that is benign prostatic hyperplasia called BPH. Benign prostatic hyperplasia. So after that, urethral stricture. So urethral stricture, the urethra is going to be constricted. So it is going to obstruct the urine outflow. So the urine will come back to the kidney and then to damage the nephron, leading to renal failure. So other causes such as cancer. So cancer of maybe the urethra or the urethra itself. So apart from that, any other thing that can lead to occlusion of what? Occlusion of this urine flow. Yeah, calculi. You can have the renal calculi itself. So which is called kidney stone, renal calculi. So the ureteric calculi as well. So there is stone within the urethra as well. The ureteric calculi. So bladder stone as well. Bladder stone as well. So all these are what? They are postrenal causes. Because they are going to bring about the backflow of urine into the kidney, and then that is going to damage the what? It's going to damage the glomerular, the nephron of the kidney, and that is going to lead to renal failure. So after talking about this, let's go deeply into the pathophysiology now. So stay tuned. Yeah, welcome back. So, we said we are going to be talking about the pathophysiology of renal failure. Pathophysiology of renal failure. Now, we know that renal failure is affecting the kidney, and the functional unit of the kidney is the nephron. That is, that structure responsible for really working, that is performing the function of urine formation in the kidney is called the nephron. That's why we call it the functional unit. Because if you withdraw out all the nephrons within the kidney is going to be useless. Although not totally useless, because that's some other structure that are really working, doing something within the kidney. So, talking about the kidney now, let's quickly bring the sketch of the renal, of the nephron rather. So, let's say we have the nephron right here. So I'm just going to be giving you the renal corpus luteum. So the renal corpus luteum, with that, we are going to understand renal failure. Now, as we all know, that the kidney, the nephron to be precise, is receiving the blood that it turns to urine from the what? From the afferent artery. So and then this afferent artery takes it into the glomerulus, and through the spaces or the pores of the glomerulus, urine is what? Part of urine is formed. So in renal failure, the nephron will not be able to do what? Will not be able to perform this function. So it means the blood entering into this glomerulus will not be filtered. And since it is not filtered, that will lead to what we call reduced glomerular filtration rate. So what is the meaning of that? These arrows facing downward denotes reduced. So the G is glomerular, and the F is filtration, and the R is rate. So it means the rate of filtering blood by this glomerulus will be what? Will be reduced. So it is not going to be filtering a lot of blood again, because that's lost its what? Its function. So when blood is not being filtered to form urine, it means there will be no urine inside this place, or there will just be what? Very few urine, very scanty urine. And since this person is not able to produce urine, it is going to lead to a clinical manifestation. Clinical manifestation means the combination of signs and symptoms. So it is going to lead to a clinical manifestation called oliguria. Oli what? Oliguria. The word olig means scanty or small. So we said it is high that there is no formation of urine at all we have scanty. So if we have scanty, the sign and symptom, the clinical manifestation rather will be what? Oliguria. But if there is no urine form, the clinical manifestation will be anuria. So the word an here in anatomy, an or a, it means absence. Although in some texts we can also call them reduced as well. So that is not what we are going to today. Now, we said there is going to be what? Reduction in the production of urine, and it is going to be manifested as this. Now, the person is not urinating. It means water is not coming out. So where is the water going to be? The water is going to be inside the person's body. Now, because the function of the nephron is to allow water to do what? Water to pass out of the body. Now, it cannot perform that function again, which means water is going to build up what? Within the body. But anywhere that water is rushing to, sodium will be rushing back there as well. Which means there is going to be what? There is going to be retention of sodium and water. Retention of what? Retention of sodium and water within the body. And now, when sodium and water are within the body, they are going to cause, they are going to lead to build-up of fluid within the body system. So we call that cardiovascular overload. But leave cardiovascular alone now. Let's talk overload. It leads to what we call overload. But anatomically speaking, when there is build-up of sodium and water within the body, it is going to cause hypervolemia. So you can call this hypervolemia. Hypervolemia. So if you say hyper means increased. Vol denotes the volume of the blood, and emia in front of it is blood. So the volume of the blood is going to what? It's going to increase. And when the volume of blood increases, what will happen? We know that the organ that pumps blood is what? Is the heart. So the organ that pumps blood is what? Is the heart. So just a sketch of the diagram heart. So the heart. So the heart. And it receives blood from what? From the superior and inferior vena cava. So if there is increase in the amount of blood going back to the heart, it means the heart will have to do what? To increase its pressure in pumping it out efficiently. Because the heart will not want the blood to be congested within it. So it's going to increase its what? Its pumping ability. And that is going to cause what we call tachycardia. Tachycardia. Okay. So tachycardia. Hypervolemia is going to lead to tachycardia. Tachycardia. The word tachy in front, it means fast. And the word cardia means the action of the heart. So the action of the heart. And when this happens, the first action of the heart will just predispose the heart to hypertension. So from tachycardia, hypertension can set in, which will be a what? Which will be a complication of renal failure. So like a quick recap before I proceed on. I said because the kidney is not able to perform its function, the nephron rather, this is going to lead to scanty urine oliguria or absence of urine totality, which is called anuria. And after that, I said since the water is not escaping from the body, it means it is building up within the body. And for water to be retained within the body, sodium is going to follow as well. But on a normal sequence, the sodium comes first before the water follows. So let's leave that aside for now. So this retention of water and sodium will lead to two pathways. But the first one is that there is going to be overload. So this water and sodium, they make up the blood volume, and that is going to increase the blood volume in the term that we call hypervolemia. So and after hypervolemia sets in, it means there is going to be increased cardiac return or increased venous return. So there will be a lot of blood coming back to the heart. That's the meaning of increased venous return. And when that occurs, the heart will want to pump with the rate at which it is receiving. So like you are getting, so you want to be giving back at that rate. So because there are a lot of blood entering into the heart, the heart will increase its pumping activity. And this will lead to a clinical manifestation called tachycardia. And this tachycardia with time is going to lead to what we call hypertension. So that is the first pathway. So talking about the second pathway, this fluid retention, this retention of sodium and water can also lead to what we call edema. Edema. So this edema is just the accumulation of fluid within different tissue spaces. We've talked about that one under nephrotic syndrome, I think, or glomerulonephritis. So I'm just going to drop a link up ahead for you to check it. So retention of sodium and water is going to lead to what? Edema of different body parts. So there can be pulmonary edema, so accumulation of fluid within the lungs, and then there can be what? Ascites, which is what? Accumulation of fluid within the abdominal cavity. And apart from that, we can also have pedal edema, so accumulation of fluid around the legs. So there can be periorbital edema as well. Accumulation of fluid around the eye, so and different body parts. So accumulation of fluid around the what? Around the cerebrum, the brain, can also cause what we call cerebral edema. I'm not writing all this because we've talked about it several times. We've talked about it under heart failure, I think myocardial infarction too, glomerulonephritis, nephrotic syndrome. So I think by now you should have understood that. So that one aside, so like it will lead to what? Edema of different body parts. So edema of the cerebral of the brain rather is going to lead to like headache, lethargy, confusion, so nausea and vomiting. So that one aside. So let's talk about retention of what we call hydrogen. So hydrogen as well will not be able to move out. But let me just explain the word I talked about that. So stay tuned. Yeah, welcome back. So we've talked about the retention of what? Of sodium and water. So talking about the retention of hydrogen now. So hydrogen is supposed to be excreted as well, depending on the acidity of the body. So when hydrogen is not excreted, because the kidney, the nephrons to be precise, cannot perform this function. So hydrogen is going to what? It's going to increase. So the hydrogen is going to build up within the body. And when hydrogen builds up within the body, the normal pH of the body, so from our pH scale, we have from 0 to what? 0 to 14. So 7 being the what? Being the neutral. So from 0 to 1 is acidity. And from 7 to 14 is alkalinity. Alkalinity. So if there is increase in the amount of hydrogen within the body, it is going to tilt the what? It is going to tilt the pH scale below 7. So which means acidosis will come in. So we've explained the meaning of osis. So if you say acidosis, it is just what? Increase in the body's acidity. So that acidity now, there will be a lot of hydrogen, there will be a lot of hydrogen within the blood. So there will be a lot of hydrogen within the blood, but let's just call it acid. So it will lead to acidosis. And now, the body will think of a way to excrete this acid. So this hydrogen right here, so it is volatile, so it can be excreted with air. So this will bring about a compensatory mechanism by the body, which is called a fast respiration, which is called tachypnea. Tachypnea. So the word tachy means fast. So this pnea is from the word eupnea. And eupnea means a normal respiration. A normal what? Respiration. So if you say tachypnea, it means a fast respiration. So the normal is out of it. It's from that word eu. The normal is from the word eu. So if you say fast respiration, it means tachypnea. So the body will increase its respiration so as to do what? As to excrete this acid out of the body through breathing. And this tachypnea is going to worsen and lead to a characteristic respiration called Kussmaul's respiration. Kussmaul's respiration. Kussmaul's respiration. So and that's another clinical manifestation for what? For renal failure. So now let's talk about the buildup of potassium and urea phosphate. We are going to combine those ones together. But for potassium, strictly, we know that potassium is responsible for doing what? For muscle contraction. That is the function of what? Of potassium. So for example, now this is our body cell. If this is nucleus, we have a lot of potassium within our cells. A lot of what? A lot of potassium within our cells. But outside, we have few potassium. So potassium should not be too much in the extracellular fluid. Extra means outside, cellular, the cell. So potassium is very few in the extracellular fluid. The function of potassium is to do what? Is to bring about the contraction of these cells. Do we get that? To make them to do what? To contract, to contract rather. So muscle constriction most of the times. So muscle what? Muscle constriction for them to do what? To constrict. But in renal failure, this potassium will build up within the what? Within the extracellular fluid. So, and when it builds up, this will bring about fast activity of the what? Of the muscles. And the muscle immediately affected in renal failure is the muscle of the heart, which is myocardium. So this is going to bring about a regular beating of the heart, which is known as cardiac arrhythmia. Cardiac what? Cardiac arrhythmia. And with time, it's going to get weak. And when the heart gets weak, this is going to come down with heart failure as well. As another complication of what? Another complication of renal failure. So talking about the deposition of phosphate and urea. So other things that are going to be deposited within the body, I mean retended. So we will have the person will have rather. I'm sorry about that. So the person will have sodium retention, hydrogen retention, water retention, potassium retention. So urea retention, urea. So then phosphate as well, phosphate, and then from phosphate, there is still one important component to talk about. That is the creatinine. Yeah, creatinine. So, talking about all these three guys here, accumulation of urea, phosphate, and creatinine will lead to a lot of reactions within our body as well, and they are going to be manifested as side effects, such as nausea and vomiting. This urea, when it irritates the what? When it irritates the GIT, it can cause nausea and vomiting, diarrhea as well, diarrhea. And for the phosphate, this phosphate can be deposited on what? It can be deposited within some mucosa membrane in the body. So, and then within the blood, it is going to lead to phosphatemia. So, for this urea now, this is going to lead to increase in blood urea nitrogen that they used to call BUN. So it means blood urea nitrogen. So, and then for this creatinine as well, it's going to build up in the body system. So this urea and this creatinine is where I'm going to. They use it to what? To diagnose renal failure most of the time. So when they test for blood urea nitrogen and it is elevated, which means the urea and nitrogen they are not getting out. This nitrogen, the term for increased body nitrogen is called azotemia. So when there is high level of nitrogen within the body, they call it azotemia. Arrhythmia, but that's what I'm going to. Like they use them, this BUN and this creatinine level to diagnose renal failure. So that is that about the pathophysiology of renal failure. So this is the end of this video, and I take it that you enjoyed the video, except for the voices of vehicle that you are just going to be hearing. I'm very sorry about that. This video was short in the day, so I just take it that you enjoyed it. I'm very sorry about that. Some other time we are going to take precautions. So if you enjoyed the video, do make sure you give it a thumbs up, and if this is your first time watching the video from the SSG Nation, do make sure you subscribe and hit the bell button so we can notify you whenever we create. Hi guys.